enter the room.
Hello, I'm Dr. Eamon, one of the doctors here in the GP surgery today. Could you please confirm your full name and age for me?
Hi, doctor. I'm Samantha Collins. I'm 14.
Hi, Samantha. Nice to meet you. How can I help you today?
Doctor, I actually have an embarrassing request, really. I'm hoping to get these morning after pills. You know what I mean?
Samantha, yeah, it's okay. Don't be embarrassed. There's nothing to be embarrassed about, all right? You can relax, and whatever we discuss here, it's going to stay between us, okay? So it's all right.
Okay.
So why do you need this morning after pill?
I actually had unprotected sex with my boyfriend Marcus last night.
Okay, Samantha. So since you're needing this morning after pill, I would like to ask you a few more questions regarding your sexual health, all right? So is this the first time you have had unprotected sexual intercourse?
Unprotected, yes, but
All right.
kind of use condoms. Yeah, this time we didn't.
Okay. So Samantha, how long have you been sexually active for?
About 2 months now, but Marcus and I
Oh,
have been in a relationship for like 6 months already.
okay. And so we mentioned that this is the first time you had unprotected sexual intercourse, and previously you were using condoms.
Yeah.
Okay, all right. So Samantha, have you ever had been any diagnosed with any STI?
No, not really.
Okay, so and currently, are you having any discharge or from your front passage or any burning sensation while peeing?
No, doctor.
All right, okay, I understand. And you mentioned that you have been in a relationship with your boyfriend since 6 months. So, how did you meet him? Where did where did you meet him?
Oh, he goes to my school. He's
Oh, okay. So,
to me.
sorry, he is?
He's 1 year elder to me.
Oh, all right, okay. And Samantha, just to be sure, I need to ask this. Is anybody forcing you or any kind of pressure to be in this relationship?
No, doctor. And we're in love.
That's good to know. So, anybody pressured you for the sexual relationship?
No, doctor.
Okay, that's good to know, Samantha. Okay, since you're asking for this morning after pill, so exactly when did you have the unprotected sex?
Last night.
All right, and have you what do you understand about this morning after pill? Like, what does it do?
It would stop my pregnancy. It will, I won't get
Mhm.
pregnant with it, I guess.
All right, and what do you understand about its side effects? Any idea?
Um, no, not really.
All right, okay. And any are your parents aware about relationships, Samantha?
Oh no, yeah, they're not okay with me being with anyone actually.
Okay, any particular reason you think you can talk to them? Any particular reason why?
Yeah, well, I think they're just very, strict Roman Catholics, and they don't really support these things.
Okay, I understand. I understand that there can be strong religious beliefs. That's understandable. All right, Samantha, could you tell me, how would you feel if you are denied the morning after pill today?
Oh, doctor, I was really hoping you could help me out. I don't really know
Mhm.
what else to do. Yeah, I mean,
Right. Okay. Don't worry. Let's see how we can help you. So, Samantha, do you understand, what happens, what will happen if you continue having unprotected sexual intercourse?
yeah, there's a chance I could get pregnant. I mean, that's exactly why I came here. I mean, to make sure that I'm
Mm-hmm.
not.
All right. And if you're denied this pill today, would you continue being in a sexual relationship?
Yes, doctor. I mean, we are in love.
All right, all right. I understand, Samantha. Okay, I would like to talk about some your overall health now. Okay, so could you tell me when was your last menstrual period?
About 2 weeks back.
2 weeks back. Okay, are your periods regular?
Yes, yeah, they've been pretty regular.
Okay. Okay, any irregular bleeding between periods?
No, not really.
Okay, any medications you are currently taking for anything?
No, doctor.
All right, any long-term medical condition you have been diagnosed with?
No, doctor.
Okay, any allergies to any medication?
No, doctor.
All right, all right. Thank you so much for answering all of my questions, Samantha. So, so you mentioned that you had, unprotected sex, and you would like a morning after pill for you today. So, before I can prescribe that to you, I would really like to talk to you about, how it works and the potential side effects. So, Samantha, this morning after
2 minutes
pill,
remaining.
it actually, prevents by preventing fertilization, like which means that it preventing a pregnancy to happen. However, if somebody is already pregnant, the morning after pill won't be effective. Are you following me?
Oh, okay. Yeah.
All right, and also this morning after pill is just for emergency contraception. It does not it's not a solution for long-term contraception. Okay, do you follow?
Yeah, I do.
Yeah, yeah. And it has a lot of side effects as well, especially if used long term. And in short term, it can lead to, nausea, vomiting, headaches, dizziness, as well as spotting, irregular bleeds. Are you following me?
Okay. Okay.
Okay. Okay. Uh, and and do you understand that what I told you about it if being effective only if you're not pregnant yet, and immediately after, like it's best to use it as soon as possible after sexual intercourse. Do you follow?
Yeah, yeah, I do.
Could you please repeat for me what do you understand about, how it works?
Yeah, it's basically stops, you said fertilization,
Yeah,
and
yeah,
you should take it immediately, and it's not good for
exactly.
the, yeah.
Exactly. So that's why I will prescribe it to you, and I would ask you to take it right now in the clinic in front of me. However, it might lead to, you might feel nauseous, and if you happen to vomit within the first 2 hours, I would, after taking it, please come back so I can give you another one. Okay?
All right, sure.
Apart from that, I want to tell you that they don't protect against STI, so I would recommend using condoms. All right, for
Mm-hmm.
that. And about
Move on to the next station.
Not bad, doctor. That was good. That was really good. This time
I,
you
this time I missed about the parents. Totally.
So one thing is there that since especially you have so much to cover, most of the time you might not be able to finish the station. Yeah, a
Right, right.
lot of people also agree that was a very good consultation. So, when you see that you are running out of time, and when you came to the point of saying that I'm going to be offering you this pill, talk about all the other things you want to offer quickly, like, so I'm going to be offering this pill to you, especially since I understand that you understand what it does and when to take it, right? And
Mhm.
if you experience any of the side effects. But I'm going to give you some leaflets so that you can read up about, what you should do. We're going to be talking about some long-term, contraception options that you can think about. I'm going to talk to you about the importance of using a condom, yeah, which can help you
Mhm.
with STIs. And along with that, I want to set up a follow-up so that we can have these discussions about the long term. Yeah, how does that sound? What would you like to talk about first? That way you're
Okay.
mentioning all the points in succession about everything that you want to include in management. Does it
Right,
make
right.
sense? So that way the examiner kind of knows that, all right, she knows what is to be done. So you'll get some amount of marks for that. And by giving her the option of what they want to talk about first, then they can, talk about the most pressing matter that they have to talk about. Yeah.
Okay. Thank
Well,
you.
I think you covered a lot of good points there. Good job. Good job. That was great.
Thank you. Thank you, Dr. Anne.
All right, let's quickly look at the performance sheet the second time over. Just give me a moment. The performance was also great. All right, look at that. That was good. Yes, yes, confidentiality. Make sure to tell that, everything will be confidential until there is no risk to anyone. Nobody is in any immediate danger. That's very important.
Okay.
Because confidentiality has its limitations, and that is the limitation, and you have to mention the limitation, Without mentioning the limitation, you can't, offer
Right,
confidence.
right.
Then they'll come
Okay.
back to you and be like, I thought everything was confident.
So even if you mentioned that early on, that unless there is a risk, so I just thought it might not put them off and they might not share if I say that early on.
So that you have to protect yourself, doctor, more than anything else.
Okay, okay, okay. Thank you.
You are trying to make sure that there is no risk, and you have to mention that limitation in your confidentiality. That is something that you ought to offer.
Okay.
Right? So, and that's what even you're also trying to say, right? That I'm going to be helping you out until there is no danger, to the point where, I make sure that you are safe. That's
Yes,
exactly.
exactly.
Because technically, if you're offering the pill to her, you're actually offering it in good faith, making sure that she is protected against unwanted pregnancy. That is also going towards protection, right?
Yeah.
All right. So, yes, partial for that one. Otherwise, what brings you in today? Yes, primary reason, clarify the timing and context of unprotected intercourse. When did it happen? Was it consensual? Ask about the sexual history, previous sexual partners, and history of STI testing. Clarify details about the unprotected sexual intercourse and if any contraception is usually used. Yes, ask about the age of a partner and whether he's in a relationship, whether the relationship is consensual and free from pressure. Assess the safeguarding concerns like coercing, grooming, or abuse. Right? Explore the patient's understanding of contraception and sexual health. Assess her understanding, important point, of emergency contraception pill. Ask how she think it works and when it should be taken. Explore the menstrual history in detail, length of cycle, last menstrual period, any irregularities. Ask if she understands the advice, would continue sex with or without contraception, and her willingness to involve her parents. Ask about the past medical history, STI, allergies. Okay, so this one, I think this time you missed out a little bit. The willingness. So at every point, whenever you have a chance, you have to ask them, would you be comfortable to involve your parents? You understood why she's not comfortable enough. But it's actually important to keep, putting that supportive point in that, it will be great if you actually do involve your parents. This is it would be nice to have your parents by your side when you're making it.
Yeah, and also I wanted to say the way you asked, how do you feel if we don't give you the contraception today? That doesn't really, that question doesn't really help. Instead of asking how would you feel, you should ask what would happen, like in a way that would she continue having unprotected sex if you don't give it? That's what you need to ask, right? I mean, how would she feel? She'll definitely feel betrayed. I mean, if you don't give.
Right. Yeah. So how should I put it in a better way? Like even I felt that.
Yeah.
Like it
So,
felt like,
would you continue having sex without contraception? Moving forward, just ask that directly.
Yeah.
Instead of saying if you don't give. So if you the question makes sense if you're giving normal COCPs, because right now emergency contraception is something you have to give, right? So that is something that doesn't really change much from your asking that question.
right, makes sense. Thank you so much.
Yeah, that's actually good because if you actually go back and think about it, you asked two questions around it. You asked me how I feel, and then you asked me, what would I do if if you don't give me the medication, right? So,
Right. So I just asked, like, what would you do if we don't give you today? Like, if you're not prescribed, what would you do? That's better, right?
or what do you think happens, right?
Oh, okay, okay.
That's also an important question. What do you think happens if you don't take the contraception pill today? Right? Like, what is her understanding of taking the contraception itself?
All right.
Right? Yep. All right. So ask about the past medical history, STI, allergy, and current medication. Use PMAF-TOSA for structure. Check understanding throughout the consultation by using TeachPack. Can you tell me what you have understood so far? That's an important point. Explain that. Okay. Now, once that is done, management. Explain that she's at a risk of pregnancy and within the window of emergency contraception. Offer the pill by saying, since you've understood how it works and we've had a good discussion, I can offer you the emergency contraception pill today if you're comfortable with that. Offer emergency contraception pill, emphasize urgency, most effective within 24 hours. So you mentioned that, you know, if you have it right away in front of me, that's good. Suppose if it's not there in if it's actually not there in the clinic, that might actually be a scenario. I'm talking about a real kind of a scenario where it might not be there. So then you have to tell them after you buy it from the pharmacy to take it immediately. Right. So
Okay,
you
okay.
have to take it immediately. Okay.
Okay, yeah.
So yeah, discuss side effects, nausea, vomiting, spotting, menstrual changes, and what to do if vomiting occurs within 2 hours. Discuss limitation of emergency contraception pills and the necessary long-term solution. Explain emergency contraception is not a regular method. Let's explore options for long-term methods. Yeah, I think you mentioned long-term methods, but I'll give you a partial for this one. You can mention that there are different types of methods, you know, in the forms of pills, implants, and certain devices, you know, that you can, you know, put, right? Discuss STI risk and offer STI screen. Explain the emergency contraception does not protect from, you know, infection. So you did not offer the STI screen. So I'm going to give you a partial for this.
Yeah.
And she doesn't really know if she's gotten any STIs, right? Like since she has been active. Advise consistent condom use and educate on dual protection from pregnancy and STI. Encourage follow-up in 1 month to review contraception needs and emotional well-being, right? Provide written information, emergency contraception leaflets, local sexual health clinic, contact STI screen pamphlets, document. Yes, you missed a very important point. Document is very important. So make sure that when you're finishing it up, wrap up. When you're wrapping up also, just make sure to mention about documents. So when I said that, you know, state things one after the other. So do not forget the documentation part. You know, I'll be documenting all that we discussed here today. Just a short line if you're running out of time. But this is very important, especially in these kind of cases. Safety netting, the condition, and so when you're wrapping up, always try to include 3 things in all of your consultations. That is, number 1 is, you know, safety netting, what to look out for, follow-up, you know, when would you set a follow-up to discuss the long-term medical plans, and leaflets and pamphlets so that you can refer to them if you have any questions or doubts. And I'm also giving you important contact numbers that you can contact in case you have any queries or questions. Right? So that is something that you can do in one go, you know, towards the end when you're running out of time. Yeah. Safety netting condition, complications, warn the next period may be early or late, and that a pregnancy test should be done if it is more than 7 days late. All right. Interpersonal skills, validate the patient's feelings and concerns about her relationship and parental reaction. Use open body language and active listening to build trust. Reassure the patient of your support and confidentiality. I'm going to give you a partial for this. You have to mention its limitations as well. Provide clear, non-judgmental information on contraception, on emergency contraception and its use, Educate on the need for regular contraception and safe practices. I'm going to give you a partial for that. Provide any patient's misconceptions or fear. Be sensitive to the cultural background and the mother's religious beliefs. Respect patient's autonomy while guiding her. Reassure confidentiality until there is no danger. Okay, I'm going to give you a yes and a partial for this. Danger to anyone involved, and offer support with gently encouraging involvement of trusted adults. All right, awesome. Yeah, that's a great improvement. So a couple of management points and time.
Please like and subscribe to Turing Med School. Good luck with your preparation.